Recording. All right, welcome everyone to today's event, which is the last one for Diversity Week. Today we're going to discuss cultural diversity and physical therapy in the world. We have panelists from Alabama and different countries in Latin America. I really wish we had someone also representing the Asian community within our panelists. We actually had someone scheduled, but there was a conflict with the hours, so she couldn't be here. But there is a YouTube video of an interview that she did, which I'll share a little bit more about later. And I have a little bit of a presentation I'd like to share to give you guys some context about why we're having this event. So here we go. Can you guys see that okay? All right, so here. Okay, so cultural diversity and physical therapy in the world. Unfortunately, right now there's with the current world events, there's the Asian community is not having a great time. So I wanted to sort of share some resources for us to be able to support our Asian brothers and sisters in any way that we can. And I would also like to share some of these resources on the chat. You can check them out later at home. So here they are. Okay. Sorry, I'm having technology challenged a little bit. Okay, so to give you some context about why we're doing this, last year, Midwestern University held a vigil for George Floyd. This vigil was organized by Midwestern students, and it was and some Black students had an opportunity to talk about some of the things that they wanted or needed to be addressed. And from there, the Midwestern University 5-step call to action program was initiated. This call to action program included making diversity and inclusion task forces in each of our colleges, within each of our programs. And I decided to be a part of the diversity in the academic curriculums, which plans to add diversity into our curriculum. So from there, the idea to have Diversity Week was born, and we formed the Diversity Task Force. And I just wanted to acknowledge my team's involvement in this, which is Tian and Eric and Danielle from second year PT students, and also Ted and Oscar and I, who are first year PT students, and Dr. Cargelas, our faculty advisor. And the purpose of this task force was to cultivate physical therapy graduates who are culturally sensitive and engaged professionals who are prepared to be leaders of the future. And we've been working very hard for a few months now, and everyone has contributed tremendously to every day of this week. So thank you so much. And with that, I'd like to share our YouTube page. You can look it up by MW Diversity Week, and we have a lot of great content. There's a video, as I said, with Dr. Lightsey and her experiences as a physical therapist in China. There's a video about overcoming language barriers in the clinic setting. There's a video about mental health, and also some research that Dr. Subialka, one of our teachers, has made about social determinants of health in physical therapy. And this one's probably my favorite one. It's Dr. Neal interviewing one of her patients with multiple sclerosis. And it's very insightful and also funny, and you guys should check it out. And then we also have Danielle interviewing one of her friends who is an expert in underprivileged youth. And I will share the link to the chat. If you give me one moment. There it is. That's a link. Okay, so some rules about how our event is going to go. We're scheduled for 2 hours, and our panelists will first introduce themselves. They'll share with us where they're from, their background, and any other insightful information that they would like to share. Once everyone has introduced themselves, I'll ask the first question, and you guys can decide who goes first. And then from there, I'll point to the person who will go next, just to keep things moving forward. If any of you have any questions, you can write them on the chat and I'll try to address them as they come. But I like to first address the questions that we have prepared, and then at the end, we will have time to address any other questions. So to our panelists, thank you so much for volunteering your time and making space in your busy agendas. I know for some of you in Puerto Rico and Dominican Republic, it's already pretty late at night, so thanks so much for being here. Faby, I know you also have a very busy schedule with teaching classes and home PT and everything, so thank you for being here as well. And Breana too, I know you're in clinical rotations right now, and you still made time to be here, so thank you so much. Yeah, did I miss anyone? I think that's it. Okay, so during Dr. Subialca's presentation, he said something that really stuck with me, and that is to use our words to heal and not to harm. And I would like all of us to keep that in mind as we discuss the various topics that we have for tonight. One last thing about this discussion panel is that it is multicultural, and a few of our participants, their English is not their first language. So we might have to be translating back and forth. So it'll be a bilingual event. And Faby will also help me if I get stuck with some of the fancier Spanish medical terminology that I might not know. So thanks, Faby, for that. All right, then let's get started. So Breana, would you like to introduce yourself, please?
Hey everyone, I hope y'all can hear me. My name is Breana Richardson. I'm from Huntsville, Alabama, which is the northern part of the state, really close to Tennessee. I did my bachelor's in kinesiology at the University of Alabama at Birmingham. I graduated there in 2017, and I'm currently in the Alabama State University Doctor of Physical Therapy program. I'm in my second to last clinical rotation, and so I'll be finishing up in the end of July. So kind of just why I wanted to go into PT. I've been a dancer my whole life, so I've always been interested in the human body and how it works and how it heals. And so I just kind of merged that with my love for helping people. I went through like a few different career choices, like in healthcare, before I settled on PT, because it just made sense to merge these two passions together. So that's a little bit about me.
So thank you, Breana. Did you even share your page by any chance, PTs of Color?
Oh, no, I'm sorry. Yeah. So on Instagram, I started a page, Physical Therapists of Color, PTs of Color, almost 2.5 years ago. Before I started PT school, I was looking for a page that represented minorities in the profession, and I didn't see any, so I made one. So I created that page, and I run that page. And so if y'all want to follow it, I'll put it in the chat. But yeah.
Yeah, she has some great content. I follow her. So, okay, thank you, Breana. All right, Silvio, would you like to introduce yourself? Oh, Silvio, you're muted. Quítale el mute.
I'm sorry. I am.
It's okay. It's okay.
Hey, hi everyone. My name is Silvio Cerda. I'm from Nicaragua. I have 30 years old for in my profession as physical therapy. by now moving to Jarabacoa, Dominican Republic, and I have 7 years serving here in Dominican Republic. It's a pleasure to stay with you and talk about the physical therapy. There are many diversity in different countries how apply the physical therapy in different patients with different pathology. Yeah, it's the great night for start with you. Is that my work in Dominican Republic is my small clinic. In the second is the living room for the many patient or family of the patient wait of the patient inside the clinic. In the next page of I have photo when I take care with patient with the permanent lumbar. And now I specialize in lumbar back pain of the patient. Is the patient with the herniation discal, multiple herniation discal. I am going to apply the Mackenzie exercise Mackenzie for relieve the pain of the patient. And then I had many pictures on my page on Facebook for the social media. And I need conversation with the patient, explain how they regulate his functionality in different part of the body, correct the exercise or correct the good position for make the exercise. The other part is the in my clinic coming many students for America student for physical therapy. This is the great fellowship, and I stay Denise in 2014 would visit me in Jarabacoa. We had many things for desire study physical therapy, and now is the one a good example is Denise. Yeah, Denise is the study doctor for physical therapy, and passed with my clinic and saw how work in the clinic. And yeah, there are many students coming in the summer on the different university for serving with me with many patients. Yeah, but this is the great community with the American people to know how the thinking many people John about the physical therapy, why is decided to study physical therapy. But this is the great work and is my job. I love my job. I love serving with my patient and serving with other people of American. Yeah.
Thank you, Silvio. Silvio has been a great mentor for me. As he said, I visited his site in 2014. I got to see how he works in his clinic, which is outpatient clinic, and he also volunteers his time at the nursing home, at the special education. There's a special education school where he also serves. And when I was there, he was very, very welcoming. I still remember our coffee breaks. I don't know if it's the Dominican Republic coffee or what, but I still think about it every now and then. I've tried to recreate it, and it just doesn't work out the same. So thank you, Silvio, for being here. So next we have Joel from Puerto Rico.
Hi, everyone. I'm very humbled to be here sharing this time with you. Well, like Denise said, my name is Joel Velez. I'm from Puerto Rico. First of all, I want to excuse myself if I say something out of place or funny, just like the Cuban singer Celia Cruz once said. My English is not very good looking, and so bear with me. I have high hopes. So I did a bachelor's degree here in Puerto Rico in cellular molecular biology. I have also an MPH Master in Public Health with a concentration in gerontology from also University of Puerto Rico. Right now, I'm finishing my DPT also in Puerto Rico. And why did I choose to be a PT? Well, since I was 19 years old, I am a caregiver of my grandma. So I decided I have seen how the geriatric community doesn't have the healthcare that they need. So the healthcare only gave them what they need to survive, but not to live their life to the fullest. So that's why I wanted to join the healthcare force in ways that I can, you know, make the lives of the elderly of the island a better place, more achievable, all their objectives and goals. And with me also, there are two classmates of mine and very good friends, Gabriela Berrios and Cristina. I would like also to them to say hi, just and share some words if they want to.
Yeah, hi everyone. As Joel mentioned before, we're third-year students from the University of Puerto Rico, and before getting to grad school, I have always been very passionate about PT. And I think what I love the most about this profession is the ability we have to help them regain function and work towards their goal no matter or regardless their condition or any physical limitation. So I think that's what I love about the profession.
Hi,
Thank you, Gabriela.
And I'm also in my third year in DPT school in Puerto Rico. I made my bachelor's degree in special education. And since like forever, I like to work with children. So I wanted to work one-on-one with children. So that's why I decided to pursue the physical therapy career.
Thank you, Christina. I'll share a little fun fact about me. I actually considered going to the Physical Therapy School of Puerto Rico as my first choice because it's the only school accredited by APTA that is bilingual. And I was researching the program and it looked great. And then the island is also very beautiful. But you know, life takes you in weird direction sometimes. So I ended up at Midwestern, which I'm really happy to be at Midwestern as well, but just wanted to share that. So next we have Faby. Could you introduce yourself, please?
Hi, everyone. My name is Faby Cañedo. I am from Hermosillo, Sonora. I graduated from physical therapy school. It'll be 7 years now. But it is a very funny story. I actually have a first bachelor degree on business management. And that was just like for me to spend some time at school since my first priority was to become a hockey player, a professional hockey player. That was the sports team. But then I had an accident, right? And this accident changed the whole picture for me. And I had to decide what to do. I did the whole process. Thought about medicine school, but then I thought about it and I thought it was kind of like a desk job and I wanted to be more into sports things and fixing people out there. So I ended up at the Universidad del Valle de Mexico school. That's where I met Denise. We used to be classmates and we used to be like teammates. We used to do homeworks together because she's so cool and she's so smart. She was the friend that I could ask for help and the other way around. So it's not fun. It's like, it's really funny that I tell my students because I invited some of them. They must be some of my students right now, right here. And I told them the story about how I ended up being here with you guys. And I thought it was really interesting because we've never had this. There could have been forums for physical therapy, but we never had, or I've never heard about someone bringing an intention of getting people from different countries together and talk about what's going on with what we do. The way people think about what we do and what we think that we do. I don't know. It's really funny, and I love the fact that I can bring my experience out here and how things have been in Mexico. But basically, an accident brought me to the physical therapy school because I had to fix my knee after like a tibial and fibular fracture. No, it was a hard thing, so it was a long path, and I loved it. And I love the fact that I'm able to tell my patients and my students and my teammates and my colleagues the way we can help people with things they didn't know they could get better at. So it's a whole process and I love it and really glad to see you all.
Would you like to share the page?
Yeah, some of the things that we've done since Mexican, we've had some situations in regards of the legal part of what we do. What we do is pretty much, and I'm pretty sure that it happens everywhere else, that there's other people that work with the same purpose, but they did not study it for it. So what we do is that we are empowering the Mexican, specifically Sonoran, which is the state I live in. We're up here, like southern Arizona. We're right here at the border. I have some of my colleagues. What we created this Asociación Sonorense de Fisioterapeutas, which has been 3 years since we decided to start working on specific purposes, as in bringing on academic workshops, make sure that whenever a student decides to pick up on a certification or anything, that it has all the requirements to meet academic purposes. And we also work with social wise. Right there we are, the picture she's showing is the president and Ana Lucia. President is Armando Campos. He's the one who brought us all together. He's one of my greatest friends and the creator of this idea, and we're still working on. We started up on being 7 people, and let me show you, see if I can bring you to that picture where it was 3 years ago. It was one of the first, let me see. It's a it has to be one of the first. So we started being 7 people, and things got really good since there was a lot of people wanting to work in the same path. So we started out being 7 and started in Hermosillo, and now we are all around the state. We have 4 different cities managing the same purposes, and now we're around 31 people working at the association. And we also are on the path of becoming a colegio, which help us in the way of making the legal alignments work for us. So it is a whole path. We're also part of the FEMEFI, which is a Mexican association, started the same direction. We're getting things, because we used to be, and this is a really sad thing, we used to be at the level of, which is not a bad thing, but it's not our place. You are gonna agree with me on that. But we were on a, as if we were technicians or even lower, legal wise. So that would bring a whole really bad scenario for us at the moment of wanting to charge or talk about what we did. And some Amasuas was better paid than what we were paid. So it is a whole thing that we're working on, and that's the Asociación. If you want to go over there and click and see what the activities we've worked on. We've also helped other states create their own association and work the same path. So this is like a ripple effect of what we need to be doing all around the world to make sure that we are walking the right path, right? So that's where I'm working mostly. And I'm also a university teacher now. And I think it's great that we should do it more often, because I have so many doubts, and my students say, teacher, if I have this article about a Puerto Rican physical therapist, I'll be like, I don't know how Puerto Rico people work, for example. So that's great. I don't know if you have any questions, any doubts. I have right now Ana Lucia, which is also one of the teammates. She's in charge of convenios. She's over there. Tania Camus, I've also seen her name. And I have one of the leaders at Nogales, right at the border with the Arizona state. And those are like main leaders of what we do, then started working on different parts of the state. So things are getting good around for us, but it's a hard job. And I love sharing and being proud about it and telling everyone that what we're working on.
Awesome, thank you, Faby. For those who don't know a lot of Spanish, convenios, I believe means event, right, Faby? Right, okay.
Convenios is like an agreement that we make with people. If you can bring up a presentation, like different companies and that we can work with, libraries, We work with people that have an accounting purposes. We also have a convenio. It's like an agreement with universities to work together. We also have a convenio with uniforms, physical therapy uniforms, and the materials. We also have, like, there's two main stores where we can get everything for the clinic work on. So those are the convenios. So whenever we have like we just had a couple of weeks ago or a week ago, a contest, an academic contest between schools, and the prizes were given by them. So we gathered all those convenios. We asked them to fill out like a package, and then that was the prize that we got for the winners. So it was really fun. People stay motivated. Of course, schools had to pick on their best students, which is also motivating for everyone. And it just goes on and on. And now trying to get the graduated people together. So it's a hard thing. It's not many of us. And some of us had to go somewhere else to do physical therapy because it's not well paid here. So it's like, we're working on that little by little.
Thanks, Fabi. One fun fact about Fabi, as she mentioned, she was one of my first friends. She was super welcoming to me. When I first went to Mexico to study PT, I had cultural shock coming from the US to Mexico. So I thought that was pretty interesting, and she helped me out in every step of the way too. So thanks, Fabi. So I do want to mention that Fabi and Silvio, well, Joel and Breana are both still physical therapy students about to graduate. But Fabi and Silvio have been practicing PT for a few years now. They do not have doctorate degrees because that's not a requirement in their countries, but they are still excellent clinicians, and they have lots of clinical expertise. They're always improving themselves and continuing their education, and they follow evidence-based practice. So I just wanted to say that I respect them as much as I respect any faculty member at Midwestern University. And they're both, I consider them my teachers and mentors. And we had a few weeks of calls to be on the same page for this event. And each time I learned something new about physical therapy. So thank you guys. All right, so we'll go ahead and get started, and I'll ask the first question. It's loading up, sorry. Okay. All right, so this is for whoever would like to go first. What is something you would like the rest of the world to know about physical therapy and or healthcare in your country? For example, are there any misconceptions surrounding physical therapy? And
I'm gonna take the lead.
Perfect, thanks, Joel.
Okay, I'm gonna share the screen. Let me see if I can do it. Can everyone see it? Am I sharing the screen? Yes, okay. So here in Puerto Rico, we have been part of the USA almost more than a century. So we're still Latinos, but with some, I can say some sazon, like spice from the United States. So our health practice and education is very, very similar. It's not the same as the US. Puerto Rico's only have one PT program since the accreditation. Only one university gives the degree, and it's the only one, I would say, bilingual in the USA and territories, but usually the program says that they're mainly in Spanish. So, the only program that's mainly in Spanish. And in Puerto Rico, the physical practice is regulated by the Law 114, and it's almost more than 60 years ago that it passed. And this law binds the practice to a referral given by a medical doctor. In order to receive or to give the service, anyone has to go to the doctor, then if the doctor in his critical thinking, he thinks you need physical therapy, then you get the referral and then you go to a physical therapy. It's like a supra tertiary care. So there's no direct access in the island. Since in 2018 in Puerto Rico, the academia and the Puerto Rico Examination Board is trying to pass or introduce a bill, the Senate project bill here called in Puerto Rico 217. And this project wants to derogate the law and update the physical therapy practice. But unfortunately, it has been like 2 years. They have been in the Capitol Hill from Puerto Rico working in it, but it has not reached the floor yet. So the discussion is open. Here in Puerto Rico, we have some setbacks and misconceptions. I would like Gabriela to talk more about them. Here in Puerto Rico, people know physical therapy, but it's a hard battle with other healthcare professions like medical doctors and chiropractors and athletic trainers and so on. So everyone who gives a service similar of a physical therapist.
Yeah, so as Joel mentioned before, there are many misconceptions about our profession in Puerto Rico. And the first one I'm going to mention, I don't know if it's the same in every country, but they compare us to massage therapists. If you say you're a physical therapist, they think that the only thing you do is giving massages. They also think that we only treat musculoskeletal injuries or pathologies similar to that system. Another huge misconception we have specifically with physicians is that they think we want to do the same job or the same thing they do, specifically with PMRs. Chiropractors and physical therapists, people think that are equivalent, and they see physical therapy as an approach of modality and not a discipline, most of people. And last year, we had an issue, not directly with us as student or in our institution, but in the profession of physical therapy in Puerto Rico, where the College of Medical Surgeons of Puerto Rico, they transmitted a radio show where they exposed many reasons against any form of direct access to physical therapy in Puerto Rico. As a response to the discussion Joel mentioned before of the Senate Bill 217. And the saddest part is that many of their responses were not logical ones, and they were not evidence-based. So not only many people do not know what we usually do, but also physicians have a misconception of our profession. And they think that they are fighting against us because they think that we want to do the same thing a physician does, which that's very absurd. But yeah, that's what we're struggling right now. Thank you, Gabriela. Okay. So Silvio, would you like to go next?
Okay.
Puede decirlo en español si quieres.
It's okay.
Como quieras.
It's the same question or the second question?
The first one.
The first one, yeah. Miscommunication. Okay. And in Nicaragua and Dominican Republic, it's very similar. It's some of the misconception patients have about physical therapy. The first, this is the one of the misconception patients have, is that the physical therapy professional cannot have direct access because they cannot have the good diagnosis and they only treat the patient with massage and things you need. Yeah. But the truth is that in both countries, Nicaragua and Dominican Republic, the physical therapy started for 5 years when we learn how to evaluate and create the most appropriate treatment program for the patients. With the other misconception is the physical therapist cannot specialize, and therefore there is a lack of expertise and excellence in the rehabilitation program. The truth is that the physical therapy has the capacity to be excellent in any given specialty of physical therapy, such as pediatric rehabilitation, neurorehabilitation, orthopedic, wound care, and more. Is the about the two conception about in both countries is similar.
We're starting to see a little bit of a trend here with the massage therapists and, you know, the idea that we can't specialize and stuff like that. Thank you, Silvio. So, Breana, can you go next, please? Same question.
Yeah, so it's really, like you said, is a trend. In the US, there's a lot of the same misconceptions that have already been listed from the previous countries. When I first was looking at the question, though, you know, we're supposed to share kind of what the misconceptions were based on like other countries, of what other countries might think of physical therapy in our country, and I didn't know any. So I was hoping to hear some from the other cultures that are being represented, but it's really the same kind of thing. Like with Puerto Rico, I know Puerto Rico and US have close ties, so of course there's going to be some similarities. We do have direct access in a good bit of states, but the majority is very restricted. I know in Alabama we have, I think you can see a patient for 2 weeks without a doctor's referral. But then after that, you have to have a referral for the insurance to pay for it, which I was going to talk about a little bit later with the whole insurance ordeal. But again, a lot of the similarities that have already been mentioned, so I don't want to drag on about that.
Thank you, Breana. Okay. Okay, Faby, can you answer that first question, please? What is something you would like the rest of the world to know about PT?
In Mexico, okay. It's pretty, it has not been long. I think we have around 20-25 generations since the first university program, as like a university program. There were others which were like, if you were a nurse or if you studied something related to the body, you could take this like technician level kind of workshop throughout a year and a half or something like that, and then you could do physical therapy. That's the way it used to be. And after a while, there was the first university asking for first time like the way we do it now, and things got a bit ugly at the beginning because they would just keep us in the Suez kind of approach. Same thing as the rest of the countries. We had those misconceptions, but we could get around that somehow because there's no many law enforcement organizations that tell us what to do. So I see that having an insurance in the US and all this kind of structure-based thing, it keeps you from being free to choose the patients you work with, and we have that, which is great because we have people coming to us because they've seen that they need more the things that we do than what the doctor may give them in a prescription. So since there's been in the Mexican healthcare, diagnosis, it's an issue. It's really not so good for us. So that makes them look not so good towards solving an issue. And they come to us. And that's when we had the chance to give a good impression, and we did. And because we really, really wanted to get out of the box of being a masseuse or just someone that touches you and makes you feel better. And now we solve things and they see it, and that's an advantage for the Mexican culture. We don't have restrictions. They have tried through rumors, but they have not done anything like they've done in other places, as I've seen. And we're really positive on that way, because we can have our clinic and at the same time, it's not such a misconception, but a lot of people think that physical therapists only work for the Teleton program. Like, that's the only thing we do. Like, can you do some other things? And say, yeah, this is what I do too. And they say, oh, you're like a chiropractor. I'll be like, no. So clearing things up for people, it's a bit better because regular doctors have not done so good. But now they trust us, so which it's getting better. Some of us are able to work together with the doctors. I have a few orthopedic specialists that would say, well, I'm just having this patient and you can come and work with them right after that. I'll be like, oh, great. Now you know how to work with us. And that's been better for Mexico, I guess.
That's great. Thanks for sharing, Fabi. I just share real quick on the chat group what Teleton is. It's basically a TV program that raises funds, and then they open rehabilitation centers for children. They're actually pretty cool, but the one misconception is that everyone works at a Teleton, when in fact there's many private clinics and also institutions in Mexico as well. Okay. I would like to continue on with our second question of the night. And that is, one second, I have like 20 pages open. Okay, what are some unique attributes about PT in your country? This could be a universal strength or something that you have personal pride in. And again, I would like to ask for a volunteer to go first.
I think Silvio. Silvio, are you talking? No? Sorry. Well, I'll take the lead again.
All right, sounds good.
Don't worry. I saw, okay. Again. So what we have, what unique attribute or we have pride in of the physical therapy practice in Puerto Rico. First of all, it's not a rumor or word has it that we are very like loud, I would say, but we are very, very caring. So we are very, very, this is a culture of love, hugs, and, touch. So they are not strange. They do not see the touch strange. So they are very, very open to the services. Like I said before, we have only one program, so we share the same alma mater. So this means this makes every CI or every PT in Puerto Rico, they share like this common ground. So even some professors have been giving classes like more than 3 years. So we have this kind of bond. So also, the academia is very, very actively involved in promoting change in the legal aspects of the professions, like in lobbying in the Capitol Hill or making changes to the Senate bill. We have students, we have faculty, we have members from the Puerto Rico Physical Therapy Examination Board. We have members of the outpatient clinics. We are very, very, actively involved and promoting a change. Physical therapy program has been accredited since almost 50 years and has always remained with accreditation of CAPTE even before the law existed. So, but the law does not recognize a bachelor degree, which was at that time the maximum degree of physical therapy in the island. Also, I would like to add the Puerto Rico Physical Therapy Examination Board members are very, very have very, very good relationship with the academia. We're a small island, so they share spaces. So we have classes of we have very, very, very accessibility to the members. So it gives a plus. Also, the majority of the Puerto Rican population know there's a discipline of physical therapy. With this, they want to get the access. But with the restrictions here in Puerto Rico, we have a poverty level like almost 40%, maybe less, maybe a little bit more. This means that a lot of the population is in Medicaid. Medicaid in Puerto Rico, you need a referral to get a referral. So it gives a very, very high barrier from for people with lower income or with need of health access. So the people know there's a physical therapy, but they tend to search it and get it from other health professionals as chiropractors or physical athletic trainers or trainers from gyms. So this is before entering PT school. I was at a gym and I saw this 40-year-old woman with a knee arthroplasty, and she wanted the personal trainer to rehabilitate her, and he started doing that, and I saw that knee getting every color of the rainbow. That was just horrible. And it was like, because she wanted to get better and she needed to move, so she tended to, the access she had to a personal trainer, so he he gave her the rehabilitation. He thought he knew.
Thank you, Joel.
My turn. In Nicaragua, there is a national physical therapy public hospital funded for the government. Patients who have a loss of limb can receive rehabilitation treatment for getting fitted for their prosthesis without any financial cost to the patient. But this is the good God for the patient poor in Nicaragua. I don't have a lot financial, but we can go to the hospital public for receiving the physical therapy and receiving a new prosthesis in different part of the body. But this is the great in Nicaragua, yeah. But in Dominican Republic, there are no hospitals and there are no physical therapy public hospital. But I am work at the Christian ONG. In the Spanish abbreviation is a not-profit private organization. This clinic functions as the private clinic for those who can pay, and we can provide help to the patient who have limited resources. Our vision is to restore the physical and spiritual life for everyone in Jarabacoa community where we serve. We want all patients to feel loved and valued. We also take students for the United States who are interested in physical therapy field. They stay they stay with us is the 1 or 2 weeks, and they get to observe and my participate in my work we do in the community. Most of the time in the span of the clinic, we can have field treat and special education school and nursing homes where we will provide physical therapy service and not cost to the patient. They get to be a part of our mission and the work we do every day during their stay with us. The last recourse the patient pay of this continuing treatment session was anywhere between $2 to $4 per treatment session. It's in the past, but we will change full price for those patients who can pay for it. A full rehabilitation program for beginning to the end. The cost the patient is around the $2014 for the program. We sustain our clinic for the patient who pay full price, but all patients receive the same physical therapy and treatment for physical therapies. Easy to receive the same treatment with patient have capacity for pay all the costs at the same time with the patient. I don't have capacity for pay $2, receive the same physical therapy, but it is the one way for receive at the patient in my clinic in care at the people poor in the community with the ONGA.
Thank you, Silvio. I think when I was there, he was seeing about 15 patients or so, and some would pay full price, some would pay a very, very discounted price. And from the patients that pay the full price, that's how Silvio is able to support his clinic and also be able to help members of the community who have low resources. Thank you, Silvio. Breana, would you like to share with us some unique attributes about PT in the USA?
Sure. So one unique thing about physical therapy here is that our education goes to the doctoral level. I know a lot of other countries don't go to that level. We really only got there, I think, in the last 20 years. I think like early 2000s is when most, or if not all, of the programs had to kind of shift from that bachelor's, master's to that doctoral level. And it's unique, but it's not turned out to be the strength that we hoped it would, unfortunately. I think initially the plan was, reach the doctoral level, have more autonomy, have direct access, get higher pay. And we have not met all those goals yet. So while it's unique, it's not really been a strength, but some people are able to make it a strength. You really have to network. You have to kind of know your worth and know not to accept something that is just a completely low offer, especially when you think about how much it costs to go to school. The debt to income ratio is not where it needs to be. And so I don't know. I think it's like I said, it's unique because not a lot of people get to that level, but I don't think that it's really helped us as much as we hoped it would, especially when there's a lot of programs accepting a lot of students. Some schools accept like 3 cohorts a year. So the market is really saturated, even though, our jobs are needed. This profession is needed and it's always going to be needed, but there's a lot of PTs coming out. And of course, with the pandemic, a lot of people got laid off and furloughed and fired. So it's been a little bit of a struggle, but that would be one unique thing that kind of sets us apart in terms of the educational level.
Thank you, Breana. That was very insightful. Faby, can you share with us, please, what are some unique attributes about physical therapy in Mexico?
Yes. Good thing is that we were able to make a difference strong enough to split what we do from what other people think they could do for physical therapists. Like, we also had that thing that Joel mentioned of trainers doing this, right? And nobody was saying anything about it, but people would feel that there was no difference by working with them. So we kind of didn't have to do anything about that, just let the people notice it. And then eventually they would come to me, and this is real, many stories of many people is going through the same thing, that they would say, I've already tried the orthos option. I've already did the alpha-biotic and the chiropractor. I have already been through the blind guy with scales. I've already done a cleansing of my room and nothing's working. So you're my last choice. And then I would make it work. And then they would never go anywhere else, because they would know that we would do a conscious and thorough diagnosis. I think that's the best part of being Mexican, because we had to learn how to make the right diagnosis for our people. And that's where things got better for us. That's a skill, because then when people come to me with the same story that I've heard before, that they've already tried so many other things, they would say, and why didn't that work before? What I did is said, because they didn't know what happened to you in the first place. You are a unique person, patient, and you have this whole group of features, and they didn't see them. They just know how to do this technique, and it's not their fault that they didn't fix it, and it's not your fault that you thought you were getting something from them. And well, at the end, it kind of worked out better for us. that's a good thing. And at the same time, it puts a lot of responsibility on our shoulders, because we also have to understand and respect whenever it's not our job to fix. So at the same time, it'll be unethical that I teach my students that you need to differentiate to whenever it's your thing to fix, or the patient needs someone else, someone better prepared, or another physician. And I think that's the best part of like being physical therapists here in Mexico. We had to do that.
Thank you, Fabi. That was very insightful as well. Sounds like you guys are making some good progress down there in Mexico. So our next question will be, what are some weaknesses or challenges of the field of physical therapy? And I'll get to choose the first person now. Let's see, Silvio, would you like to go first? Go ahead and unmute yourself.
I forgot. One of the challenges as a student does in Nicaragua, there is only one physical therapy school. It is the public university, la Universidad Nacional de Nicaragua. There are thousands of students who is the whole country who want to pursue the degree, but they need excellent grades and to do extremely well on the admission test to be able to equality to get in the school. But it is indescribable competition in Nicaragua. While in Dominican Republic is completely different. Yeah, there are only 2 universities with the physical therapy degree, and they are both private. It not exist public. So one of them is located in the capital city of Santo Domingo, Dominican Republic, but it's the more comfortable and accessible for the student. The other is the region of the Cibao, where I am live, but it's so much expensive to go there. So the student needs to show based on the recursos they have. So is the difference in both Nicaragua. Nicaragua have only public university for study physical therapy. Dominican Republic had 2 universities private for study. One university is very expensive. The other university is more comfortable for study. But it depends the capacity for different family, yeah, for go to different universities.
Thank you, Silvio. In case I didn't mention it before, or Silvio didn't mention it, he's originally from Nicaragua. He studied there and became a physical therapist there. And then he moved to Dominican Republic and has been practicing there for quite a few years now. So that's why he can give us perspective on both Nicaragua and Dominican Republic. So thanks, Silvio.
Yeah.
Okay. Breana, could you share with us some weaknesses or challenges of the field of PT in the United States? I know you've already touched on a few points, but if you have any more.
Yeah, well, I was just going to kind of expand more on the like insurance and direct access issues, which really go hand in hand. In the United States, insurance, like health insurance, I think all insurance is really car insurance, all of that is based on your employment. And so if you're not working, then you don't have the best choices in insurance. And even if you are working, depending on the job and how much you make, your benefits and all don't really cover as much as some other policies do. So that's a weakness just for the citizens living here. And so tying that into direct access, like I mentioned earlier, only a few states have like completely free, unrestricted direct access where patients can come to you without a referral, without a script, and get physical therapy. Most states are restricted and have different varying like time frames of when you can get a script and how long you have to see them before you have the script. So for the people who do have direct access, they're paying out of pocket which is okay for someone who can afford $150, $200 a week for 6 weeks. But if you have insurance, your copay is maybe $20, you're paying $40, $60 a week. So that's, again, if you have insurance coverage. So then the flip side, as a physical therapist, you're having to bill appropriately. Like when you evaluate someone and you look at their insurance, you look at how often they're going to need to come, you kind of sometimes have to work with them and say, well, you know, maybe instead of 3 times a week, you can come once a week, get all your exercises, we treat you, and then come back in a couple of weeks just to kind of help with the payment. So trying to jump through those hoops, I would say that's a weakness, having to deal with insurance and having to prove to people who never went to physical therapy school, who don't know anything about physical therapy, proving to them why you did certain things with that patient or why they needed that and asking them for approval. Like it's a whole ordeal that as a student is frustrating to learn, because I'm like, I'm just trying to treat people, and now I have to spend an extra 2 hours a day figuring out how many minutes I spent with one person and how many units I can charge them for and what type of insurance covers what and what doesn't. So that's a really big weakness that hopefully we can alleviate in the near future. I know some people are doing like cash-based PT, but again, if you can afford $200 a week, then that's great. But most people here are not going to be able to afford that amount of money for rehab. So that's the weakness here in the States.
Thank you, Breana. That again is very insightful. My parents and I haven't always had insurance, so I know the struggles firsthand. So thank you for sharing that. So Joel, would you like to share with us some weaknesses or challenges of the field of physical therapy in Puerto Rico?
Yes, I'm gonna bounce this question to Gabriela.
Perfect.
Yeah. So I think Puerto Rico shares many of the weaknesses you guys have already mentioned, specifically the US, because we are connected with them. But as Joel mentioned before, our law hasn't been updated for almost 60 years. So we still have the same law we had since we were a bachelor degree. So yeah, that's a huge weakness. There's also a resistance with many health professionals. They're trying to prevent any changes regarding the physical therapy profession. And we also have the issue, we don't have any type of direct access. So patients need a referral to receive physical therapy from a physician. And we know it's a barrier because it prevents the general population to receive an effective health service. And we also have problems with our health insurance because some of them requires a referral from a PMR specifically. So others, it's not mandatory a PMR. They just need a referral from any physicians. But there are some of them that requires a referral from a PMR in order for the patient to receive the physical therapy service. So yeah, that's another weakness we have as an island, as physical therapy in Puerto Rico.
Thank you, Gabriela. Could you clarify what PMR means? That's for me, I don't know.
Medicine and rehabilitation, which is also physiatria.
Oh, okay, perfect. Thanks so much.
I would also like to add that we like Breana said, we have like the same issues with insurance here in Puerto Rico. It's like I would like to say like a copy paste from USA. So in that way we have the same issues, just like Breana said.
Thanks, Juan. All right, Faby. Would you like to share some weaknesses or challenges of the field of PT in Mexico?
Yeah. For this, you should know this, that I asked, the answers given were not just me bringing it up. I asked the friends that I know that have done physical therapists for the longest. One of them is right here today, and he helped me out with the sensor very much. It's Juan Pablo. But he's been a physical therapist like for 30 years. So it's like a dinosaur. Educational and academic level. It started off with a level, now it's getting better because I see it. I've seen how my students are getting better education, but it's still not enough. It's not like given, same levels not given all universities, because we have two kind of universities giving this program, the public and then the private one. We started off with the private, and that one was for a structure to work, for us to work with the insurance companies, right? Or to set up our facilities. But the other program it's teaching them how to go by what the doctor says, right? So it's funny because we're noticing, and people is noticing that we are more needed than before. So that's why we have 5 universities at the city and all around the states giving the program now. There's a lot of need, and we're trying to cover it because we have this number. We're not as many. We are, because of the physical therapists that we are now, we are 1 physical therapist per 100,000 people. So we need more. We're not having and it may look like that because we have a lot of universities, but we really need a lot of physical therapists out there. There's a lot of work. Another not so good thing about what's going on here is that we're not evidence-based practice physical therapy. We are pretty much, if we like something, and I say I work different ever since I started trying to make things better, but I say we because it's generalizing, that we are looking at someone and we kind of like the way he works, and then I would do what he does. Instead of bringing this, let me check on what's going on and do the proper testing and do the proper research and the questioning and all that, so I can see what's going on. We really we're not so strong in that. We are trying to make an emphasis on that now that we're teaching and stuff, because then you see this kind of approach. Someone who has pain, and then the physical therapist just having the ultrasound thing, and then having some tense work over there and say, well, you can do this stretch and then you go home. And there's no like testing and all these proper things we need to do before and after. So we're not so strong in that. And ego issues. In some of the things that we need to work on is that understanding that our value is regardless of what other people do with what they think they do. What we do, it's bigger than what they can understand that we do. So we should not be on a struggle to make them understand that we're better. Not because we want to, but because we got prepared for it. So ego, it's because we're afraid that someone else is gonna take part of what we do. And we don't need to be afraid of that, I think. And what I discussed with my friend is that we should not be worried about all those masseuses and chiropractors out there. Because at the end, truth prevails, which is that we know better how to fix issues, right? And I think that's pretty much what sums it up.
Thanks, Fabi. That was very insightful and honest answer, which I'm pretty sure we'll appreciate. So for our very last question, what role do physical therapists play in interprofessional collaboration? And I'm going to ask Joel.
Hi, I'm gonna share again. I'm so sorry, back and forth with the sharing, so sorry.
It's okay, I love the visuals.
So I'm gonna let Christina, do you want to take this one?
Yes.
There you go.
So in Puerto Rico, since the beginning of our academic formation as physical therapists, the program invests in resources in developing us as interprofessional collaboration culture. We have classes that we learn about interprofessionalism, and we do activities with other programs. Also, collaborations and activities between physical therapy students and students of other health-related professions. Like we did an activity with the dental medicine students that we evaluated how they were sitting and their posture. We gave them some advice on how to correct their posture while sitting so they don't end up having so many back pain. Also, we had an activity with the speech and language pathology students where we also told them how to have correct posture and correct mechanics when picking stuff up from the floor, and they taught us some stuff about their profession also. And we have all these initiatives that help us nurture the interprofessional relationships. Another example is the physical therapy students have been working hand in hand with medical students in the medical science campus COVID-19 vaccination efforts. So we've been going to the clinic and we've been helping the students with the transporting patients and getting them the patients. So the pharmacy students and the medical students can give the vaccine to the elderly population. And in clinical practice, we have seen how the physical therapist has a close relationship and bond with other members of the rehab team, like OT, the speech language pathologists, nurses, and the medics.
Thank you, Christina. Next up, Breana, could you share with us what role do physical therapists play in interprofessional collaboration in the USA?
Yes. So in the United States, PTs work with pretty much any discipline in any setting. So I'll just talk about my actual program. The school that I go to is really big on interprofessional education. Our PT program is under the College of Health Sciences, which also includes occupational therapy, prosthetics and orthotics, and rehab services, which is the undergrad degree. But for like the first year and a half of my PT school curriculum, we had like all of our basic core classes with the OT students and the P&O students, which was really helpful, especially like in our gross anatomy lab when we're dissecting cadavers. We were paired up, like it was a couple of PT students, a couple of OT students, and then the prosthetic and orthotic students. So all of us in one group together is really helpful because they're in disciplines that are under rehab, but we all kind of have different viewpoints of things. So having them in my group to help explain things from a different point of view that I hadn't thought about was really helpful because that simulates real life. And so in the setting that I'm in right now for my clinical rotation, it's an outpatient orthopedic clinic. It's physician owned. So there's like a surgery, like a hospital center and doctor's offices. And then the PT office is in the building as well. So our PTs and the PTAs speak directly with the physicians. We have all their notes. We can literally go down the hallway and go ask the physician a question, talk to their nurses. So that's really helpful. I had a rotation in an inpatient rehab hospital. So with PT, OT, and speech, I got to see a lot of the interprofessional collaboration between those disciplines as well. The PTs and OTs actually worked in teams. So there would be one patient and there'd be a PT, OT team who would see them, not necessarily at the same time, but just like they would both have that patient. So they'd be able to get updates on what the patient was doing in OT, what they did in PT, what they need to work on next, how they're progressing. Also, we spoke a lot with the nurses who were there. The physicians, again, they were able to speak with them. They had team meetings every week, like kind of like rounds with all of the case managers. So it's really good here, the collaboration between the different healthcare professions and services. And I've had good experiences with my rotations, being able to kind of see that firsthand in practice, speaking to people who aren't necessarily in PT and getting to talk about the patient. So.
Yeah, that's great, Breana. Thank you for sharing. Faby, can you tell us more about the role of physical therapy, the role physical therapists play in interprofessional collaboration in Mexico?
Well, this is a hard question, because what they've done is, since they don't understand what we do, since then they are trying, I think it all goes to how they see things work for the patient. Because here's all about, what medicine can I give you so you don't feel the pain you're going through? And then goes really bad after that, because patients keep going on taking stronger pills, and at the end they know they need to get fixed, so they come to the physical therapist for it. So our role is the last resource. Another one is that when they want to work through a physical therapist, it's like, so like a pain reliever purpose, not a problem fixing purpose. They don't think we can fix things before they can take into a surgery decision. So surgery decision avoidance has been one of the goals, and they don't like that. So it became a kind of a battle for them to say they don't want to take their patients to the physical therapist because they may get away with not getting the surgeries. It's a sad thing. Or like, yeah, you can go with a physical therapist and they can teach you exercises you need so you can get better. Some of them, not in all scenarios, but some scenarios are more positive in the way of, they know that we can tell them how to get through something. And for me, since I'm a freelancer, I don't work through, I work with first-hand referral. So when people come to me, it's because someone else already told them that I could fix things. So they come in hope, and I don't fight against making them believe in me. And I like that. I haven't had my cars designed or anything like that, because I just had a baby. Well, I have a son, and he was born right after I finished school. So right now I'm barely getting out there and stuff and working on my projects, because I've been a mom for all this time. But I've seen how people can understand, and a few specialists can understand that they can work with us, a few of them. And it's only based on their ethical values. So if they know what the patient needs, they would not try to fix it themselves, and they would come to us. So it's kind of getting there, little by little. We're getting there, hopefully, soon. For patient's sake, I think it's for the patient's sake. At the end, it's for them. We can know what we know, but if the patient is not aware of it, then, or if we don't do it for them, then at the end, that's why we are coddling, and that's why people think we are all about love and taking care of our patients, because that's what we do. We bring hope to what they need. They've gone through a bad time, and we can make it better. And we're empaths, and we know how they feel and stuff, and we have the whole package for them. And that role is not understood by many doctors who just have like 100 patients per day and stuff. We kind of personalize what we do, so it'll get there.
And that's part of your job in the association, right? To bring awareness to some of these issues to move forward.
Yes. It is, because we can take advantage that there's no blocking. We are not being blocked. We're just being diminished. They say, oh, well, you don't do as much, and then we do all these big things, and they now understand. And what we do through the association is making people aware that we can work anywhere, and we do different kind of areas, physical therapy, and that we do it right. So that's the association purpose. That's the whole thing.
Great, thank you. All right, Silvio. So Can you share the role you play in interprofessional collaboration?
Yeah, well, both Nicaragua and Dominican Republic are very similar in the way the patient interact with the physical therapy and the way physical therapy interact with other healthcare professionals. But I believe that this thing come with the our culture Latin American. The patient who has a great outcomes after seeing a physical therapy, we hardly ever consult with the orthopedic specialist to let them know that they are better. The patient simply goes home happy with their outcome at the physical therapy. Only when the patient is the post-surgery, when the doctor will write a follow diet, follow the check of the patient progress. So the communication between healthcare professional is not very common. It's very hard. Possible is very hard because the doctor had a lot of patients. I don't have calculation how many patients had the surgery, how many patients going, what clinic going the patient. It's not happening in the mind of every patient. Yeah, is the way I perceive it here in the Dominican Republic. The doctor has many patients, the prescribed rehabilitation. You can go one clinic in your city, yeah, but if the patient is from Jarabacoa, only if the patient come in my clinic, in the paper is the Hospital Santiago, doctor special orthopedic prescribed rehabilitation. But if the patient have the good rehabilitation, for me, it's impossible to come back to the doctor. Yeah, going to the home happy. Yeah, but only going to the doctor when the patient have the good fightable with the doctor. Yeah, the physical therapy have a good job. Is the way rehabilitation in the part of the body. It's okay. So the patient going to the doctor, but the patient is not usually, yeah, it's few in the patient, yeah, but it's not common, the good interpersonal collaboration in the orthopedic and physical therapy, so physical therapy and physiatry, yeah, it's hard. It's similar than Mexico.
Thanks, Silvio. Yeah, it sounds a little similar than to Mexico, where some physicians are really good at interprofessional work and some are not so great. So thanks for sharing. And those were the questions that we had prepared for tonight. So if anyone has any questions that you would like to ask any of our panelists, feel free to do so. In the meantime, if you guys have any final thoughts on anything that we've discussed so far, feel free to share as well.
I'm so glad we had this conversation because I got to learn a lot from Nicaragua and from Mexico. And and with Breana, it confirms that here in Puerto Rico, we're not that far from the US practice. But what I got that is that we all share some same misconceptions and we're fighting like the same war in our countries. Like we have to, get the people to know how to get to physical therapy, to get the people to want to get physical therapy. Do not. I don't want them. I know in Puerto Rico, I don't want the people to see physical therapy like the last resource. But like in Mexico, even though we are different like practices, they don't have referral. Our practices is binded by law. We share the same, like in Puerto Rico, people come like the last resource, same as in Mexico, and also people, the medical doctors, they do not want us to, to stop the people from going to the surgery. They want to perform surgery. So here we have the same, I can sense we have the same setbacks and situations. So maybe we have some differences by law, but at heart, I think we are the same discipline. And we are, of course,
Yeah.
but we are we're not that different at all.
That was great insight, Joel. Thank you so much. There's a question on the chat from Michael. He says, it's for Breana. He says, Breana, I looked at your Instagram page. Great to see a page that highlights minorities in healthcare. Are there any common barriers or issues minorities face when entering the PT industry in the United States, or anything else you want to address regarding representation in the industry here? Great question, Michael.
Yeah, thanks for the question. I think, and from what I've seen, the main kind of common barrier for underrepresented minority students who want to get into PT is the fact that not many, and I guess this really goes for all cultures and races, PT is not taught at a very young age. We all grow up going to the dentist, we grow up going to the physician, so we know those careers and we aspire to be those things, but I don't know any 5-year-old who's I want to be a physical therapist. So I think the representation kind of needs to start from a younger age. I think that's one of the problems. Getting into schools like elementary schools, middle schools, high schools, doing career fairs and introducing people younger and younger to the profession, so that they know kind of the guidelines of how to start working towards that. I think that's one thing. And so then another part I would say is the monetary aspect of it. There's a lot of hoops that you have to go through. You need the 4-year bachelor's degree. Not everybody can afford to go to college. You need to take the GRE. That's $200 each time you take it. If you have to take it more than once, not everybody can afford that. And then paying for grad school, $20,000+ a year. There's loans, and some people are fortunate enough to have the loans and have the extra support, but not everybody gets that. So I think some of those monetary barriers are, of course, going to be hit harder on people in the minority populations, just because of the systemic issues that we all face, typically earning less money, typically coming from broken families at times, typically being in more rural areas. So a lot of factors at play, but I think the representation, I think some of the admissions processes, I know some schools are moving to a more holistic admissions process. So by holistic, that's usually not really requiring a certain GPA, not requiring the GRE exam. So taking those things out that kind of cancel out a lot of people in the first round, and looking more at people's life experiences, past job experiences, their character. If they're a people person, there's some schools who don't even do interviews. They just look at the grades. And I'm this profession is very personal. It's very hands-on. You have to know how to talk to people. And so people who have 4.0s and 400 whatever on the GRE, that doesn't mean you're going to be a good physical therapist. So I think some of the barriers that are put in place, that we think as of this is going to get us a really good applicant, are really keeping a lot of the really good applicants out of the programs. So
thank you, Breana. That was very insightful. Silvio, I'm sorry, I thought I cut you off right before I asked Breana the question. Did you want to share anything? No? Okay.
No.
Faby? Okay, go ahead.
I like to say, because it's really funny, when it first came to our state, the school was, the program was given by a private school. So my family were lower income kind of school. So I had to go through a lot of programs to get the money and also be on the good grades list so I could stay there. So it was a very hard thing. Now we have options for for people with lower incomes. And that's a better aspect of the whole thing now that the state and the public system is aware that they need what we do. And now that there is a public option, it's more available for the rest of the people. And while I was studying, I experienced really bad scenarios against of me not being someone's daughter, or having this car, or wearing, you know, the way they dress against the way people who don't have that money kind of dress. So I had that fight. I went through it. And because what was going on back there, and it was not that long ago, it was 10 years ago. So I think we are at every level, we're really unaware of what it takes to become someone who wants to do something out there. And the blockages that we've experienced have been in any other scenario. And my friend Juan Pablo just shared a very, very warm message for us all about how, as much as different we can be, at the end, we're all struggling with a culture and knowledge issue about what we do. Because what we do is not out there at the media. It's not out there at a commercial. Kids will see many commercials of going to the dentist, but not as many as going through physical therapies. So, and it goes to that. So people think that because they touch, it's just a massage. And I think it's an educational level. It's one of the things that we work on in the association, is that we have someone working with the media, right? And we create this message and we put it out there, and we have everyone sharing it. It's on Instagram too. It's called Asoft. I will, for you to go over there and see what we do. And we would just have like this intention of a ripple effect, like having everyone to work on the same purpose.
That's great. Thank you, Faby. Okay, so I don't see any more questions, and we will share our final thoughts. I want to say I appreciate everyone again for being here. I have learned a tremendous amount from each one of you. And I think, as Joel mentioned earlier, and as Juan Pablo on the chat too, we're sort of all have our struggles, but what brings us together is that we are doing our best to treat our patients with care and to improve physical therapy and within our home, right? So thank you so much, guys. I'm going to stop recording right now.